there's this sensor sheet which is kept under the mattress. It captures all the vibration produced in every heartbeat, every respiration cycles and so on. These sensors are primarily vibroacoustic sensors, which is a proprietary technology by Dozy. The data is then sent to this pod that you see over there. That pod converts it into an encrypted signal and in a secure way puts it on a cloud server, where this data is analyzed further. And the AI engine converts this into different biomarkers for the patient, like heart rate, rhythm, respiration rate, blood pressure, oxygen saturation, temperature, and so on. And whenever it sees any kind of abnormal alerts, right, which are configurable by the clinicians and nurses, it sends it to the central command station that you see in front of you. This is the kiosk which are going to be placed in places, and which can be further escalated to the handheld devices with the doctors and nurses as well, right? So that none of the alerts are missed and healthcare reaches every bed, right? So that is the idea behind how this entire technology works. Maybe if we can now show you practically how this is done.
So, adike sir, new display.
There was anxiety about physical touch. There was anxiety about how we can use our medical equipments on a patient. We had done many innovative things ourselves before the Dozy started this. Like we had given patients themselves a thermometer, a pulse oximeter, and few patients we gave a BP apparatus also, and said you check yourselves, make a note of it and take a photograph and WhatsApp to the doctors. This was something like self-monitoring of the patient we taught to the patients. And as the days went by, we told patients to self-monitor at home. Same thing was done by the patients at home and sent to the doctors. But still, there was gap. We could not ask somebody to check a saturation 24/7, minute to minute, second to second. Similarly, it's impossible for, even if somebody is there, a healthcare worker next to a patient, it's almost impossible for them to monitor every minute or every second. So we were looking at a device which can constantly monitor patients who are outside the ICU campus. Like in ICU, we have a central monitor, there is somebody watching the monitor, and there is almost one-to-one nursing, so constantly somebody is supervising. It's not a new information. In even the most advanced countries, the commonest cause for a death in a hospital is found dead in the bed. Because there are various things that can happen for a patient, like change in their heart rhythm, change in their oxygenation, which is almost impossible to be captured second to second, because we didn't have a device like that. The doctors make a visit twice a day, the nurses visit every hour or every 2 hours. What will happen between this 1 hour? Is there a way to capture the data? It wasn't there in the sense in a non-ICU patients. So when Dozy came up with this idea saying that we have, and again we did have some monitoring system earlier also, not that this is for the first time it has come out. We did have other monitoring system, but there was a lot of wires attached to the patient, so which was very cumbersome for the patient and also cumbersome for the healthcare workers. Which wire has got dislodged, which wire is connected right. So there were certain drawbacks in the earlier system. So when Dozy came out and told me once that we have got a device, patient will never know he's being monitored. There is a device which is totally contactless, and it is dynamic, and it can be seen not only by the nursing staff and also by the doctors on their devices. That's something really amazing. If I can see what is happening to my patients from home, whenever I want to know, It is something wonderful. And again, a system which alerts us. What is important? It's not just a question of monitoring. Monitoring, I can, if there's a VVIP, I will make one human being sit next to him and go on monitoring. But whenever there's human thing is there is a question of fatigue will happen. When there is a monitoring system which can send alerts, and also it can give us a trend, what has happened whole day, the previous day, for example, a week. Not only it helps us to understand the patient's trend, health status, but also it gives us information about the research. How many of us have got data about a patient admitted for non-cardiac or non-lung disease? What is happening to his saturation, his temperature, blood pressure? Somebody has come for something else, but then have we assessed these things? No, we haven't. So when the data is collected in these directions, it is a fantastic research tool also. So having understood all this, I being a clinician, I am just not an administrator. I am a clinician. Basically, I look at what information I can get out of this and how it is going to change the management of a patient. There is no point in ordering 120 investigation if it is not going to make any difference for my diagnosis or the treatment. So anything we do should have an implication on the outcome of the patient. So when they presented this to us, we went through a lot of validating ourselves. Basically, I am very critical about many things. So I won't accept. Apollo has done, they have validated, Fortis has done. It's not, I don't want to buy such an information. I would like to get convinced myself. So with our clinicians, we use this device on a test platform for more than 2 months, 3 months. We did it for 3 months. Then we were convinced that yes, this is a tool which will help us in assess a patient's condition, where if somebody's pulse is going high for some reason. It also, now the sister in the station can know when somebody's pulse goes up, then she knows there is some activity happening there. Probably patient is turning or patient has got up. So such alertness is there. And also the saturation, then the blood pressure also, the respiratory rate, temperature, all of them when I can monitor remotely. I think it's a fantastic information we have for better outcome of a patient. Other innovations, and probably patients themselves will start monitoring their systems, which has got double-edged sword. It's like a double-edged sword. It can be detrimental to the patient and also the treating doctors and to the hospitals. Like see, between 9 and 10, my heart rate was 120, nobody did anything. But for a clinician, it knows that probably patient has got this, so 120, it's okay, fine, it's acceptable. When to get alarmed, the doctors know. But the advantage of this is, it is letting the doctor know something is happening. Okay. With these few words, I would like to thank